Okay, my name is Bridgette Hightower, and I'm going to be doing the NG tube suctioning and placement. So I'm going to come into the room, knock, identify the patient, ask them if they can tell me their name and their birth date. I'm going to perform hand hygiene, provide privacy. I'm going to put on my gloves. They don't have to be sterile for this procedure. I'm going to explain the procedure to the patient. Raise the bed to working height. We raise it. And then I'm going to assess the patient's abdomen. I'm going to use, I'm going to auscultate their abdomen first in all 4 quadrants, and then I would palpate it. I would check for tenderness and distended. And then to perform the procedure, I'd put the patient in high Fowler's position. Place the towel over them, or the pad, and then hand them a cup full of water that they can use to drink so it helps with gagging, and then a tissue, and then an emesis basin. Okay, and then I am going to take the NG tube. I'll measure from the nares with the tip of the NG tube to their nose or to their ear, and from their ear to the xiphoid process. And here, where I measured it to, I'd put a piece of tape, and that indicates how far you would place the NG tube. Next, I would lubricate the tip 1 to 2 inches. And then I would tell the patient to lean their head back, and as soon as they start to feel like they're gagging or uncomfortable, I would tell them to tuck their chin down and lean their head forward and drink water. So as you insert this, do it slowly and don't force it. And you would go all the way to where you taped it off. And then you would attach that tube with a piece of tape. And then make sure that the tube suction or the vent is up on the patient. Above their stomach. You would use the syringe. We're going to aspirate the gastric content to make sure it's in the stomach. And you would pull out about 20 to 30 milliliters. And then you would document the gastric content And then you can use it. You would also check the pH with the pH strips. And then if the doctor orders, you would do an x-ray to make sure that the NG tube is in place. You can place this tube with a safety pin and a rubber band to their gown. Make sure it's above the stomach though. I would also measure the length from the tip of the nose to the end of the tube. And it's about 27 inches. And you would document that so that the next nurse knows where it's supposed to be, and then they can check it for themselves. And then to do the suctioning, you would put this clamp in, and then use the suction, turn on intermittent, and then connect this back to their gown. And then always assess the patient for pain and make sure they're doing okay. And then you would throw your gloves away, perform hand hygiene, and put the patient back down. Clean up the rest of the equipment. And that's it.